Hi, my name is Amber Watson and I'm doing an IV start and stop. The first thing you would do is verify the physician's order, and this physician's orders was for IV maintenance fluid. So then I'd enter the room and I'd identify myself like, hi, my name is Amber Watson. I'm going to be your nurse today. Can I get you to verify your name and date of birth? And I'm going to check your hospital band. Okay. And then do you have any known allergies, shellfish to iodine or anything? No, you don't? Okay. So after you verified the patient and identified and then asked them if it was okay to start the IV, if they were on board and they gave you verbal consent, you would perform your hand hygiene, collect your supplies. Let's see. And then you would have a small little sterile field area on the bedside or on the table. So, and I'm going to place the IV in the AC joint, antecubital, up in the arm, which sometimes is not the ideal place. You can do it anywhere on the forearm. You just want to use 20 gauge or above if you're doing it that high. So I grabbed a 22 gauge IV catheter needle start. So now I'm going to open all my supplies and organize them. Okay, and then I'm going to put gloves on. Organize my supplies. And then get everything ready. Then I'm also going to connect and then you want to prime the tubing. Just get enough fluid through till you see a drop, okay? Then place that back down. Then you want to feel for your vein by applying a tourniquet. And it's always nice to not completely tie the tourniquet, that way you can release it with one hand. You want that tourniquet to be at least, I would say, 4 inches, 5 inches away from where you're actually going to do your venipuncture. How I do that is I take my 4 fingers and I measure that from there. So I would technically be inserting the needle down here. So once you do that, you feel for the vein. Okay, there's a great vein right here. Then you're going to want to clean the area. Break the ampule. And you're going to do this for 30 seconds, scrubbing back and forth, vigorous motion. To really make sure and ensure that we're not going to enter germs, pathogens into the vein or blood supply. So okay, and then you want to let that dry. You don't ever wave your hand or blow in the direction, as that would defeat the purpose and it would no longer be clean. So I'm just letting that dry, and then I'm going to start with the venipuncture. It's still a little bit wet. You want to secure the vein by anchoring it. So that means holding it, and you're doing this so that the vein doesn't roll. It happens a lot in elderly patients that you'll go to do the needle stick, and by the time you actually insert the needle into the skin, the vein will roll. You're going to go bevel up at a 30 to 45 degree angle depending on what patient you have. So we're going 30 degrees. And then, so we're in the vein because we see a flash, then we insert just a little bit more to ensure that we're completely in the vein with the catheter. Then you use your first finger to advance that catheter. To where the hub is all the way. And you always want to make sure that you've lowered your angle of the needle, because you don't want to, once you're in the vein, you want to be parallel. So you want to thread that catheter straight through. So you drop that angle from a 30 to almost a 0. So you thread that through, then you're pulling the needle out and deactivating that needle. I still put it in the sharps container. Okay, and then I'm grabbing this and I'm connecting that. We are releasing the pressure. And first you're going to aspirate to make sure you're still in the vein. So you see blood once you've aspirated, and that is great, but now you need to flush that line. And always be holding that catheter in place so it doesn't come back out. So we're just flushing that line. Real life, the NS would not be going all over the counter. This would be going into the patient's vein, and it would be a smooth transition. And you want to do it slow because it can cause a burning tendency if you do it too fast. So if you want to be nice to your patient, you'll do it slow. Okay, so once you've completely flushed that line, made sure that it's patent and open, you lock the device. That way when I pull this syringe off, blood's not going to start pouring all over. So we undo that, blood's not coming out, and that's great. So now we're going to secure the catheter with the Tegaderm or whatever your facility has on file. You want to make sure that the site is open in the window so that you can see, look for signs of infiltration or any cellulitis or any problems associated with an IV going bad. That's why we have this clear window so we can see in the future. Then a lot of IVs come with the name and this, so you can go ahead and insert that, or yeah, just do that at the bottom or top, whatever, and then go ahead and make a loop. And then normally you want this tape already cut because it would have been easier, but you make just one giant loop and you're just securing, which is really hard on a banana, but on a human this is a lot easier, to use one piece of tape to secure that tubing and anchoring that down. Then you also want to do your initials, AW, the date, 10/3/20, and the gauge needle that I used was a 20 gauge needle, so that anyone coming on shift after you is aware of when, what you started, and if it's the appropriate gauge for certain medications like vancomycin and things like that won't go through certain gauges. So that's highly useful to know. Plus, of course, you're going to document that in your EHR. So we've got this all secure, and the IV would be great. So the next thing we would do is we would take off our things and we would hand sanitize, make the room tidy and nice for the patient, and then Then you'd return their bed, verify that they're okay, return their bed, and you would be done. And now we're going to start the discontinuation of the IVs. So let me get some. You would have alcohol, or let's see, we just need gauze and gloves. And so you would enter the room again, and you would verify your name. Hi, I'm Amber. I'm your nurse today. Looks like you're going home, so we're going to discontinue this IV. Is that okay with you? Okay, and of course you'd verify the patient all over again like it was a brand new experience. Name, date of birth, any allergies. Fantastic. How's this IV feeling for you? Okay, let me perform some hand hygiene. And also get some tape and get some gloves on. And you'd raise the bed to your comfortable working height. Is it okay if I raise your bed so I can reach this a little better? Okay, great. And then you'd get your gauze, and then you have another one for the end where you're gonna have that folded. And then what I like to do is get your tape. So that's all ready, and all you have to do is grab that. Normally you have like a bedside table, so this is my secure bedside table. Okay, so we're gonna start by anchoring the catheter. And in elderly patients, you want to be super careful. Use alcohol if necessary, because elderly patients, their skin is going to tear when you start pulling off all this tape, and it's highly uncomfortable. As good common practice, I just use alcohol with all patients. It makes it a lot better for them to handle. You're securing this catheter the entire time because you don't want to lose it. So then you grab your gauze, and you're gonna place that at the top. And you don't want to press pressure while you're pulling out the catheter, but you slowly pull that. And then after it's out, then you apply the pressure. And while you're applying pressure, it's a good time to look at the catheter size, make sure it's intact, make sure you're not missing pieces of it in the vein. This one looks great, so we can put that in the sharps container. So you apply this pressure, minimum of 30 seconds.
2.
Okay, and then you get a new folded gauze. Throw that into the, okay. And then you use one piece of tape, Coban, whatever your hospital's protocol is. Secure that. Tell them that they can just have it apply pressure for 10 to 20 minutes, just until there's no more bleeding. Then you discard your gloves, perform hand hygiene. Also, you would lower their bed, put them back, make sure they have their table, and if at this point you need to do discharge training, you do that, or you'd exit the room. Thank you.